Hello, this is Pei Zhang. We'll be covering articulating written communication in this presentation. Again, I wanted to let you guys know that the content of these presentations is taken from the book Translation Practices Explained, Medical Translation Step by Step, Learning by Drafting, and the authors are Vincent Montalto Resorricio and Maria Gonzalez Davis. What is a genre? Well, basically, texts share participants, functions, and the situations in which they're used, as well as formal conventions with many other similar texts. That is, any text belongs to a more or less recognizable textual genre, such as editorial, original article, review article, case report, book review, textbook, clinical guide. We could define genre as the formal characteristics that one must observe so as to be recognized as correctly following the visible rules and expectations. Genre, more fundamentally, is a kind of activity to be carried out in a recognizable textual space. That activity embodies relations with the readers and kinds of messages to be developed in order to carry out generically appropriate intentions and interactions, to complete the rhetorical and social possibilities of the genre. Thus, genre presents an opportunity space for realizing certain kinds of activities, meanings, and relations. Genre exists only in the recognition and deployment of typicality by writers and readers. It is the recognizable shape by which participation is enacted and understood. According to this definition, an original article as a genre is not just a set of formal characteristics, structure, length, tenor, degree of specialization of the information contained, and so on. That must be fulfilled, but is also a communicative activity carried out by researchers whose purpose is to convince readers of their conclusions, gain prestige, make the discipline advance, and so on. Thus, written communication in health practices covers more than just the purely expository research genres. According to the overall rhetorical purpose of the writer, we can distinguish three basic types of genres. The first is instructional. So basically, instructional genres give instructions to readers so that they can carry out certain actions. Examples are clinical guidelines, patient information leaflets, and manuals. The second type of genre is expository, and that provides information to the readers. So we can have anatomical atlas, treatise, review articles, case report, first part of an informed consent, for instance. Or you can have the argumentative, the purpose of which is to convince readers. An example of some of those genres are medical editorials, original articles, posters, and health campaigns. In addition, we can distinguish further medical genres according to their overall social function. So let's see if we have a social function of preventing disease, for instance. The genres would be institutional campaigns such as press releases or information for patients. If your social function is to carry out domestic actions such as following a diet or treatment, then you will have a diet or patient information leaflets. If it's to communicate new discoveries to non-specialized readership, then you can have a newspaper article, a summary for patients. Some genres are used to store information and transmit it among members of the same knowledge community, whether it's professional, researchers, physicians, and so on, or non-professional, such as patients and general public. For example, a research article is conceived of as a genre for storing highly specialized information so that it is available in the future and for transmitting it to the community of researchers in that particular field of research. Likewise, the clinical history of a patient is a macro genre used to facilitate clinical exchange between and activity in health professionals during treatment. Some other genres are used to bridge communication gaps between speakers of the same language that belong to different knowledge communities. So, for example, if you have a communication gap between the patient and the physician, if the patient needs to understand clearly the details of that disease, you can use fact sheets or patient information leaflets for that. How about between the patient and the researcher? Well, let's say the patient needs to and have the right to know the process or the progress of the research in the disease that affects them. You can have a summary of research articles for the patient or another popular article through a popular magazine or press release. If the communication gap is between the physicians and the researchers, physicians might need to apply advances of research in order to improve their clinical practice. Then you can have a clinical guideline or a review article. Why should we pay attention to genres and not just to the texts when translating? In professional practice, a translation is required and commissioned when there is a communicative niche, in our case, the need of a text, within a target communicative situation, and more specifically within a target genre. Thus, when translating, target genre knowledge and skills are key elements from both a communicative and a formal point of view. As medical translators, we're especially interested in genres because our translation strategies, procedures, and decisions may depend on 4 factors. First, comprehension. Understanding the source text depends on the profile and previous knowledge of the reader to whom the genre is typically addressed. A medical translation student will be cognitively and communicatively closer to some genres, such as patient information leaflets, than to others, such as clinical trial protocols. Socializing with genres with which we're not familiar is vital for the adequate comprehension of specialized texts. Second, translation process. Knowing about structural elements in different genres enable us to anticipate the type of information we should be looking for as we read the source text and draft the target text. Third, interlinguistic differences. Even if the target text belongs to the same genre as the source text, there might be important differences in the way it is realized in the target culture. And lastly, genre shifts. Depending on the translation assignment, the target text may or may not belong to the same genre as the source text. How do we spot genre? So let's look at some of these and see if you can guess where it was written. Without humor, life would be undeniably less exhilarating. Indeed, the ability to comprehend and find a joke funny plays a defining role in the human condition, especially helping us to communicate ideas, attract partners, boost mood, and even cope in times of trauma and stress. These beneficial manifestations are complemented at the physiological level, where humor is thought to have numerous salutary effects, including acting as a natural stress antagonist and possibly enhancing the cardiovascular, immune, and endocrine systems. So, where is this taken from? Is it a newspaper article, a specialized medical text, or a resource book for comedians? If your answer was the specialized medical text, you were correct.